Yo, what is up YouTube? It's your boy Bobby D, and I'm back again with another hot, juicy video. And as always, I'm joined by the hair Moses himself, Steve Cook.
Bobby.
Thanks for being on my channel, Steve.
My pleasure.
And if y'all don't realize, Steve has his own channel, Defeating Hair Loss. I make an appearance, every so often, try to help out when I can.
Hair, Bobby. It's the hair.
It's the hair. It's a good hair day. Jokes aside, but y'all know when Steve's here, we always talk about hair. And tonight's topic, Steve, is, on my channel, I've already talked about, oral minoxidil and taking that. And we talked a little bit about side effects. But tonight I wanted to talk about, either you're taking, the topical or the oral, is there possible, major side effects that you could get possibly, or what are your thoughts?
Well, Bobby, I encourage everyone that watches your channel, that watches Defeating Hair Loss, or any channel for that matter, that's looking to help with hair loss, I kind of defer to their doctor. So I advise them to, if any questions, go see your doctor. Now, that's kind of a double-edged sword. It's a little, bittersweet kind of thing, because obviously I'm doing the right thing. I don't know anybody out there who's watching. So they're like, hey, who is this guy? I have no medical training. Of course, I come from the school of hard hair knocks. And that's for a long time.
Hey, you're the legend, Steve Cook. Don't sell yourself short.
But I don't want to ever put it out there that I am medically trained. So what does that mean? Well, that means I have no idea what I'm talking about, right? So the point is you go to see your doctor and ask your doctor about any of these medications, whether it's topical or internal, oral medications. What I will tell you, yes, with all my experience, is there's very few side effects, if any. Let's start with the oral. The oral minoxidil is dosed for male patients at 5 milligrams, for female patients at 2.5. It's actually a hypertensive medication. That's where they got it from years and years and years ago and turned it into a topical. And hypertensive meaning for blood pressure. And you might be like, well, Steve, I'm 20 years old and I'm going to be looking at blood pressure medication. Well, at 5 milligrams, it's really a non-factor. So it really is not going to affect your body. The side effects from the oral medication potentially could be like the hairs on your body that you have could get stronger. I don't feel like I've actually grown more body hair. One is that my hair's gotten stronger on my body. I feel like it's working on my head. Some guys and girls have even talked about, temporal peaks and, not facial hair on women, although if they're from the Mediterranean or the Middle East or Latin America, they may have a little bit of facial hair, not like a beard, but that can get a little stronger.
So maybe I can grow my beard finally, Steve.
Maybe grow your beard, that's right.
Let's look into that.
If that's a side effect, that's a side effect. But you can keep in mind that we're talking about saving the hair on your head, which is what this is all about. As far as health-wise goes, and your cardiologist, your blood pressure medication, when you don't have any blood pressure issues, the only thing you want to be careful with is, let's say, for example, you're a 78-year-old female patient that wants to stop her hair loss, means a lot to you. You're 70 pounds, 75 pounds, you're a little woman your whole life, and you're taking 2.5 milligrams of minoxidil. There's a chance that you could have a little inflammation in your lower extremities. It can cause a little bit of inflammation. Then we would back it down to 1 milligram, and usually that always does away with that. What they're saying about it online as far as heart palpitations, arrhythmia, and all that, I've never seen that happen or heard of that happen to anyone that I've ever been in communication with in regards to the oral minoxidil. Now, topical minoxidil, that can cause irritation to the scalp. And that's kind of a tough one, because, here you are doing this twice a day application, which is very challenging to do, Bobby. And your scalp is kind of like flaky and it's dry and it's irritating and you're itching all the time. It's a nightmare. So, the original pharmaceutical company that launched this was Upjohn way back, I think it was in the mid 80s. And this was it. This was the holy grail. This was what, hey, they've got it. It's now no more guys going bald, no more women losing their hair, just rub this stuff on your head. But from that time, I always remember that it was always really challenging to not have the flakiness and the dry scalps. So that's where then I defer to the oral minoxidil, which you're not going to have that with. In conclusion, what we want to make sure of is that we get good photography prior to taking any of this stuff. Stay off the internet, communicate with your doctor, or better, your hair surgeon, because they know how to use that medication and how to guide you. And as long as you have photography and you're able to see the results, then any possible potential side effect you may get, as long as you stay off the internet, because that's usually placebo, you shouldn't have any. So I don't really see a lot, Bobby, at all with any of the patients that are taking either oral or topical minoxidil, other than that irritation.
Awesome, Steve. Well, I appreciate you dropping some knowledge as you always do. And as always, everyone, check out Defeating Hair Loss. Great channel for hair. And be sure to like and subscribe to my channel, and we'll see you next time.